Hey mama, you're probably pregnant right now, and that's why you're here. And you may be wondering, how in the actual hell is this baby going to come out of my body without leaving me wrecked? And you might be Googling, you might be thinking, my vagina is going to be torn to, the seven winds. And why does it feel like it feels down there right now? You're in the right place. I've got you. I'm Dr. Marcy, Doctor of Physical Therapy, board certified in women's health, and I am your go-to girl for everything birth prep, pregnancy, pelvic floor, core, recovery, postpartum, all the things. I'm a mama too. They were gigantic babies, flew out of my vagina, and I've been doing pelvic floor work for over 15 years. In this free masterclass, I'm going to teach you how to reduce your risk of vaginal tearing during your delivery, protect your pelvic floor, the most important group of muscles in your body, but the most ignored, and have a better, faster recovery. Like actually heal from this birth and pregnancy. And if you stick around through the end, you'll get exclusive access to my bundled program, which is called Down There Done Right. And we'll also get you into 3 private classes that I don't sell on the website, but are so necessary. Let's do this. All right, y'all, this is what we're gonna cover today. You're gonna leave here knowing what the pelvic floor actually does, what it looks like, and why it's gonna be your new BFF in terms of your pregnancy, your birth, and your postpartum. You're gonna understand why tearing actually happens, what the risk factors are, and how to prepare your body for this delivery so you can reduce your risk of those significant tears in your vagina that cause long-term problems. And we're going to talk more about that as we go on. I have a proven method. It's called the 3P's. And this helps prepare you for birth so you can avoid all of these pelvic floor issues and long-term problems that will affect every single part of your life. I'm talking mental health, spiritual, physical, emotional, all the things. And your next step after the masterclass is to get into the full Down There Done Right bundle. It's all of my courses put into one nice, neat package that's going to serve you from your pregnancy all the way through postpartum. It's discounted and it's chocked full of bonuses just because you came into this training today. So good on you. You're going to walk away from this today knowing more than 95% of women out there. A little bit about me. I have spent over 15 years working as a pelvic floor physical therapist, helping thousands of moms nationwide, other countries. It's been a dream. And I work with women from first-time parents to elite athletes to moms that have had 6 children. I help them prepare their bodies for their delivery and recover like pros. But y'all, this isn't just about me and my experience and what I've done. This is a personal journey, and this is about you. I've been doing this work, like I said, for a long time. I knew from the beginning that I wanted to be a pelvic floor physical therapist. I knew that I wanted to help women just like you prepare for delivery and get your bodies ready, not only for getting the baby out, but also for the pregnancy. I have seen and heard really scary, terrible things in my career. And I've had the opportunity to go all over the country and treat women in all sorts of different walks of life, in all sorts of different cities, locations, healthcare systems. But there's one common thread. And that common thread is that traumatic delivery, pelvic floor problems, and this overwhelming feeling of, I didn't know, nobody told me about this. Why isn't this standard of care? Why don't people talk about this? Is the link that links all of us together. And personally, for me, recently, my sister had a horrible traumatic delivery. My sister, my flesh and blood, the one person who should not have had any sort of adverse effects that could be prevented, had basically everything happen that shouldn't have. And I saw this happen from minute 1. And I flew to her as soon as I could, 2 days after her baby was born, and had to fight tooth and nail for her in the moment to get adequate care and recovery. And even just for nurses and doctors and insurance providers to just listen and hear what was happening to her. And this is after I've been doing this for 15 years. To see this happen in real time completely rocked my world. as it did hers. Pretty much all of the issues that she experienced, all of the trauma, all of the terrible decisions that were made, all of that was preventable, and she deserved better, and so do you. Let me teach you how to reduce your risk of vaginal tearing, get ready for this delivery, be confident going into your birth, be clear, know how to advocate for yourself, and how to put yourself, your needs, your family's needs at the forefront. Y'all, motherhood is hard, okay? We don't need to be spending our time and our energy worrying about if we're gonna tear our vagina in half. Sorry to be blunt. You've got bigger fish to fry, so let me help you. Okay, so you've probably prepped for the nursery, got your diaper bags ready, you've got your car seat, you've got everything checked, you're ready to go, but we're missing one big step here, okay? And that's you. Kind of important, mama. Your childbirth classes that you have previously taken, either locally or virtually, focus mainly on the baby, which is important. Yes, okay? It's important. However, we also need to have information, resources, and knowledge that benefit you as the mother, okay? Nobody tells us as women and as moms how to actually get that baby out, what options are available to us in terms of pushing positions, medications, how are decisions being made in the delivery room based on what factors. What position should I push this baby out in? How do I actually push? What happens when the baby comes out? How do I do that first poop? When do we go to C-section? What's the benefit? There's all of these things that happen during pregnancy and labor and delivery and early recovery that affect you directly that are just ignored and pushed under the rug. And y'all, this is not lip service. This happens every single day by the millions. No one is helping you or prepping you to actually do the work of the labor and the delivery. So here's some stats. 85 to 90% of vaginal births involve some sort of perineal tearing or vaginal trauma. 85 to 90%. C-sections do not protect against pelvic floor issues. A lot of my mamas who have C-sections will experience pelvic floor problems postpartum that are very surprising because baby didn't come out of the vagina. So why am I experiencing leaking, pelvic pain, prolapse, C-section scar pain? Why am I experiencing a lot of these same issues, minus the C-section scar, that my mama friends are experiencing when the baby came out? That's because the load of the pregnancy and the labor, and if you had a scheduled C-section, you fall into the camp of like the load of the pregnancy. If you attempted a vaginal delivery, pushed for a while, didn't go well, and had to go into C-section, you have like a double whammy. So in lack of better terms, it's the load of the pregnancy that affects the pelvic floor, not just how the baby comes out. And most of these birth injuries, most of these pelvic floor problems are either preventable totally, or we can reduce the severity significantly. And that's why you're here. That's what we're going to change. Let's do a quick anatomy overview. Make sure that you understand what the pelvic floor does, why we love it, why it's so important, why I'm obsessed with it and vaginas and all the things. But let's just talk really quick, like structure. Okay. The pelvic floor is a basket of muscles. All right. It's like a hammock. It goes from front to back and side to side. So all this red stuff that you see here is pelvic floor muscle. It's skeletal muscle. It's the same stuff as your bicep, your quad, your neck muscles. So it can get strong. It can get weak. It can be prone to injury. It can get tight. You can have spasms in there. It can do all the things that other muscles do. Okay. But because of where the pelvic floor is, like at the bottom of our pelvis, it is super important. Okay, one of the main functions is support. It holds everything up. So we're talking your weight, we're talking gravity, we're talking fluid, your guts, everything is held up by the pelvic floor. Without the pelvic floor, everything would just fall out of your vagina. So let's add a pregnancy on top of that. So we have a baby that's getting bigger, a placenta, a uterus that's 100 times bigger than it was, increase in blood volume, increase in fluid, larger breasts, weight gain, gravity, all the things that we have kind of on a normal basis are now multiplied. And they're all sitting on your pelvic floor muscles during pregnancy. It's a lot of load, okay? It's a lot of load on those muscles. Support is one function. The second function is continence, okay? This is what keeps us dry. It's what holds in urine, stool, and gas. So for example, as the bladder is filling with urine, the pelvic floor muscles turn on. There are special receptors in the bladder wall. We don't really need to go into that. But when the bladder fills like a balloon, those receptors are activated, tells our brain, oh gosh, okay, I have to go pee. Pelvic floor muscles are like, oh, my bladder's getting heavy. I have to work more now because there's more fluid in there. Pelvic floor muscles turn on, close down the urethra, support the bladder. We walk to the bathroom, we unbutton our pants, we sit down. The bladder muscle pushes urine out and the pelvic floor muscles relax. Okay, same thing happens with gas, same thing happens with stool. So it keeps it in, all those things, until we're ready to go to the bathroom. It also plays a role in sex. So those muscles around the opening to the vagina here, this first layer, they have to lengthen and open to allow penetration, okay? Whether that's a penis, a finger, tampon, speculum exam, whatever has to go into the vagina, those muscles have to lengthen and open to allow that to happen. They're also attached to the sides of the clitoris. So when you have an orgasm or when you climax and you get that like rhythmic pulsing contraction, that is from your pelvic floor muscles. So sexual function, continence, and support. But here's the crazy thing, and this is why I'm so obsessed with these muscles, and I think that they're just like so amazing, is that they have to stretch, okay, to the entire circumference of the pelvic bowl here. Okay, that is how we get the baby out, because the baby is sitting right here in this pelvic area. And for 9 months, these muscles have been contracting and holding everything up. And now for labor and delivery, when it's time to get that baby out, these muscles have to lengthen, open, and get out of the way so the baby can come down through the vaginal canal and exit out. The wild part is that after that baby comes out and those muscles have just done that incredible feat, we are just told that they should just go back to acting normal by 6 weeks without any help, without any rehab. And now you're probably experiencing leaking, pain, prolapse, all of these things that happen, but those are considered now normal. But prior to the pregnancy, they were not. So there's a big kind of gap here. There's a big few links in the chain are missing. Something that used to be considered abnormal and dysfunctional now is considered normal, just part of being a woman. That's what happens after having a baby. Musculoskeletal injury, trauma, tears, cutting, instrument delivery, all those things, totally fine, no big deal. But that's not the case. This muscle group is critical for your health, both short-term and long-term, and it needs your attention before we have to try to get that baby out. So let's talk tearing. Why do some women tear and have very significant trauma during their deliveries and some don't? Well, there's a couple of things that we have to think about. We have risk factors, preventable risk factors that we can modify and change, and then other risk factors that we can't. Okay, the risk factors that we cannot change are genetics. Some people have more stretchiness in their tissue. Their collagen, their muscles, their fascia just has more laxity, has more give. We tend to see less tearing and trauma in those populations because that tissue is able to accommodate for the baby, but we might see more prolapse, more supportive dysfunction, more leaking because we don't have as much inherent rigidity. Now let's compare it to somebody that might have a little bit more rigidity in their tissue, a little bit more tightness, a little bit more tone. We might see more tearing and trauma perhaps in that population because the tissue can't quite accommodate well, doesn't have a lot of range of motion or stretching as the baby comes out. And so path of least resistance, something has to fail, and that's where we usually see tearing or trauma. The other factors that we can't control are size of the baby, Big babies, bigger tears. Although that's not always true in the literature. I've had many patients anecdotally who have had gigantic babies, 10 pounds, 9 pounds, with very minimal tearing, especially after they do my program. And then I've seen women in the clinic who have had very significant tearing, 3rd degree, 4th degree tears, haven't done my program, and their babies were smaller, 7 pounds, 8 pounds. So it's not only the size of the baby, okay? Another risk factor that we can't control is speed of the delivery. If a baby flies out of the vaginal canal very, very fast, the tissue doesn't always have time to accommodate. So we tend to see more tearing and trauma during that. The other side is long pushing phases. ACOG, American College of Obstetrics and Gynecology, define a long pushing phase as over 90 minutes. I pushed for 3 hours with my first one. My second one was like 20 minutes. My sister with a traumatic delivery who ended up with vacuum and tearing and all the things, it was like so bad. They allowed her to push for 5 hours, which is absurd and negligent. Okay, so long pushing phases, we tend to see more trauma for obvious reasons. And then of course, if we're using any sort of instruments, so forceps, vacuum, if the physician does an episiotomy, which is a surgical incision that needs consent, we'll talk about that later, we tend to see more pelvic floor issues, short-term and long-term. Baby position is something that we can't control. If baby comes out what we call sunny side up or occiput posterior, we tend to see a little bit more tearing and trauma and the pelvic floor muscles. If baby is transverse, obviously we can't get that baby out, so we're going to have to go C-section. There are some hospitals and delivering providers who will deliver breech babies. If that is determined to be safe for you, we might see some more trauma as well because a foot is coming out first versus a head. And so we might have some lack of accommodation there in the pelvic floor as well. Not a ton of literature on that specific to pelvic floor tearing and trauma, but my assumption would be because it's probably a little bit more of a difficult delivery in terms of pushing, then we would see kind of the same things that we would see with longer pushing phases. And then of course, lack of prep. Lack of prep falls under this category of risk factors that we can control for. So things that we can control for would be position of mama, position to push in, medication use or not. I'm going to teach you what you can do with meds on board or not to reduce your risk of vaginal tearing and trauma. And something called coached pushing versus spontaneous pushing. These are all factors that we can control for. So we need to make sure that we have a balance here. We do as much as we can with what we have, and we understand what the risk factors are. So if something happens that is out of our control, we have a plan, we are advocating for ourselves, we understand what could happen and why, and we're able to start the recovery process right away. Makes a huge difference. So the key for reducing your risk of vaginal trauma during the delivery is really understanding these risk factors that are modifiable. We want to help your body accommodate and get ready for that baby. Muscles need to stretch and lengthen. They have to be able to move. We need to make sure that any residual scar tissue from previous deliveries can move and allow muscles to get out of the way. I'm going to teach you how to prepare your pelvic floor and control these risk factors in this training. And we go way more in depth in our full bundled program. Let's break down the 3P method. This is my signature system. It's been used by thousands of moms, both virtually and in the clinic. I teach it every single day. I have physicians that I work for that bring me into the hospital, bring me into grand rounds, and they say, I want to learn what you're teaching your patients. This is unbelievable. I've never seen anybody push a baby out like this before. This is great. Teach me everything so I can apply it. And I'm like, absolutely, it's my favorite thing. Like I will die happy. So the 3P's stand for perineal massage, push prep, and practice like you play. So let's break it down individually. Okay, perineal massage. You might have heard this or seen this maybe in social media or Googling. What you will find on YouTube or on the internet is probably a picture of a nurse doing some sort of stretching with 2 fingers right here in this area while the baby is crowning, perhaps while mama is flat on her back with her knees up, and like a little squirt of Johnson's baby shampoo. That is not effective perineal massage. And in fact, If that happens for the first time, if that's the first time you've had somebody working on those tissues, is when the baby is crowning while you have meds on board in the dorsal lithotomy position by somebody that is not manually trained, you might see more tearing and trauma because that tissue might get swollen, bruised, and it now becomes more fragile. So when you look at the literature, a lot of the studies that show that perineal massage is ineffective in reducing risk of perineal trauma is looking at it done in that scenario. That's not what we do. That's not effective, and it's contraindicated. Effective perineal massage is when we start it at 32 to 34 weeks, depending. You can do this at home. You do it with your partner. You come into physical therapy to have it done. I know a lot of you can't do that. You don't have the time, the resources, or the finances to spend multiple appointments, nor probably you don't have a pelvic floor PT in your area. And this is going to help you actually manually prep and get the tissue ready. This not only reduces your risk of significant tearing, but it also helps with postpartum pain and speeds up your recovery because we're not dealing with so much trauma in the acute phase. I show you exactly how to do it with all sorts of different modifications in Down There Done Right. But the thing that you need to take away from this right now is that you can start doing it right now during your pregnancy, as long as you're not on pelvic rest, you don't have an active infection, you're still having intercourse. Nobody from the medical community that's following and keeping you safe has told you nothing in the vagina. If you're having sex, you can start to do perineal massage. And a quick breakdown of that, like I said, we go through it so much in the program, but what you can start doing now is using one thumb and going right into the vaginal canal. Think about the vagina like a clock. So the bottom is 6 o'clock. We go 3, 6, 9. And you want to start stretching that area from 3, 6, and 9 o'clock. Okay. And you want to feel pressure. It's going to feel a little burny and icky and like, wonk. And as you're starting to accommodate and stretch, that initial uncomfortable feeling starts to dissipate. You do not have to go crazy in there. Okay. You can do very gentle, very specific, very steady stretching and opening. And like I said, as it starts to feel uncomfortable and yucky, you breathe into that, release and relax your pelvic floor muscles, and you push a little bit more. Okay. We are never going to stretch your pelvic floor to the size of the baby's head. It's just not going to happen. All right. That's not the goal of this. The goal of this is to get your brain used to that sensation. So it knows how to tell your pelvic floor muscles to release and open despite this uncomfortable feeling. It also gives your muscles, it's like a manual therapy. It gives your muscles the resources to stretch and lengthen. Okay. Just like if you wake up in the morning and you have a crick in your neck and you're walking around with tight neck muscle and there's a lot of pain and you can't like bring your shoulder down, same thing happens in your pelvic floor. If your pelvic floor muscles are tight and unable to go through their full range of motion, they will not be able to effectively lengthen and get out of the way, especially when you're trying to push a baby out. And that's where we see more tearing and trauma because the muscles are just like, oh my gosh, I don't know what to do. So it would be like, instead of stretching and releasing this tight neck muscle, it would just be like trying to throw a baseball while everything is all in spasm and tight. I also teach your partner how to do this. Okay. So there's lots of different ways that you can do this at home, both with partners, with tools, with your doulas. There's so many variations that you can do that are effective. And that's what we go through in the program. The second P in the 3Ps is push prep. Okay. This is the secret sauce. This is what no one teaches in birth classes. Because remember, those birth classes are about baby, how to swaddle, how to do the car seat, like bring a robe to the hospital room, yes, super important, all the things, but this is how you actually start to prepare and learn how to push. Okay. You need to be able to stretch and get in positions and practice exercises that bias the pelvic floor into lengthening and into relaxation. Okay. You also need to know how to do what's called bearing down. And this is where you see in social media reels or in movies where people are like, push, push, push. It's hard to do. And if there's been previous trauma, or if your pelvic floor is tight, for example, or sometimes just because like we're not really connected to that area of our body because we can't see those muscles. So it's very hard for the brain to figure out like how to activate them, how to squeeze, how to relax, how to bear down. You need to learn how to actually push and bear down so the muscles are able to not just relax, but also to get out of the way. Okay, so this is very, very important. Bearing down and pushing is a skill. It's a learned motor control skill. It's not just, oh, you're going to push that baby out like you push out a poop. No, bearing down follows three things. Your breath, okay? So it's going to follow what your diaphragm is doing. You're going to push and bear down with uterine contractions. And then there's also something called the fetal ejection reflex, which is what helps the baby come down. So you will get the best bearing down when we couple it with those three things: breathing, contractions, and fetal ejection reflex. You don't want to just be pushing for the sake of pushing. And that's what coached pushing is. That's when somebody else tells you when to bear down or push, when to start, when to stop, what position, how hard. No. The literature and the evidence support something called spontaneous pushing, which is you push, you bear down when you feel the contractions, when you feel pressure, and when you're able to get the best push for your body at that time. The other thing that you want to think about when we're talking about push prep is practicing pushing in different positions. And we're going to get to that on the next slide when we talk about the third P. But you want to make sure that you understand that in between contractions is time to rest and let the muscles accommodate and get used to this force and this increased strain. So when you're pushing, baby comes out, stretches the tissue's blanch, which means blood flow gets away from the perineum. Then the contraction is over, baby comes back just a little bit, tissues can relax, you can get a drink, like a little sip of Gatorade, an ice cube, you can squeeze your husband or partner, you can, scream profanities, do whatever you need to do. Next contraction, little bit more. And the tissues accommodate a little bit more, rest, you go back. So it's like this kind of 2 steps forward and 1 step back. And that's what reduces your risk of significant vaginal tearing because the tissue has time to accommodate and get used to this load. Coached pushing, vacuum delivery, pushing without the rest is where we see the most trauma because we don't have, like the tissue is just constantly loaded. There's no rest or ability for graded and slow progression. Pushing is a skill. You should know what it feels like. Because it's a skill, we can actually train for it. Third P, practice like you play. Here's the concept, and this has been proven in physical therapy literature, rehab literature, sports psychology, sports, athletic training, all the things. You want to be able to put your body in game-like situations for the best outcomes. Okay, so what that means is that we wouldn't put somebody who has never thrown a baseball before on the pitcher's mound in a game in the World Series, right? We need to train our bodies in these game-like, sport-like settings. So think about if you are training for a marathon, you're going to run, right? You're not going to train for a marathon by watching other people train for a marathon, listening to people's stories about training for marathons, watching people race in marathons. You're going to actually put your body through a specific, regimented, proven training program that allows you to get to the finish line in a safe and effective way with less injury, less risk of overuse, all the things that training does for us, right? Training, the goal of training is to make sure that we get to what we need to do physically without hurting ourselves in a way that can be prevented, right? Same thing for birth. Same thing for birth. So here's what this means for you. In practice like you play, we are combining all of the things that you've been working on. perineal massage, push practice, what positions are good for you, bearing down, breathing, all of the things that you need to be successful in pushing that baby out the most efficient way with the least amount of trauma. We practice that prior to delivery. So simple. I give you tools, and we can actually use physical tools, but I give you kind of metaphorical tools to make sure that you understand what it feels like to push something out of your vagina. What position is the best for you to push that out of your vagina? Like, for example, if somebody gets a better bearing down or a stronger push in side lying, and we know that ahead of time, then that is going to be the position that you probably are going to want to choose when you are having your baby. Okay? Makes sense, right? Secondly, you want to have an arsenal of positions. You want to have an arsenal of tools. You want to have an arsenal of questions, answers, scenarios that simulate the real thing. So when it's go time and that baby is crowning, you're not wondering what to do, where to do it, how to do it, how do I do this, where do I go here? And we haven't even talked about prior deliveries, either C-section or vaginal, that may have had some trauma that could affect what's happening the second or third time around. So you want to know what positions and what scenarios are going to be best for you and protective of whatever previous injuries have happened. Same thing that goes for mamas that have never had deliveries before. But let's say we have back pain in pregnancy, we have a hip problem, labral tear, maybe we've had a knee surgery prior to getting pregnant, maybe we have pubic symphysis pain, which is pain in the front here of your pelvis. This is right where the pubic hair goes. Maybe we have a pubic symphysis dysfunction. That is important to know and to treat accordingly as you're pushing a baby out, because there are certain positions and certain techniques that are going to be more advantageous and more protective based on what you have going on. Okay. All births are not created equal. All bodies are not created equal. All babies are not created equal. So what works for one person is not going to work for the other. But what the problem is, one of them, even though it's like, it's just one tiny problem out of like, a bajillion, is that everybody is put in the same position. On your back, feet in the stirrups, a nurse yelling at you to push as hard as you can so steam is coming out of your eyes and you're bursting blood vessels and all the things. That is not advantageous for you as the mom and also for the baby, right? Baby has to go uphill. You have too much medication on board, you can't feel a contraction. You're not able to get into different positions because you don't know that you can. So all of these things that come together under this umbrella, under this positive ecosystem, all of these things we can train for. So when game day comes, when your crowning moment comes, you are ready and you're like, okay, let's go. And when you try one position, you're like, don't love that. You've got 15 others that you can choose from. And you can say, you know what? I remember I got a really good push here. Oh yeah, I feel really good when my husband holds my leg in this position. No, I don't want this person over here holding my knee up because that hurts me. So you can be able to create this birth experience, this delivery experience that is specific and personal to your body, your needs, your preferences, while keeping the baby safe, you safe, and protecting your pelvic floor and getting your recovery going ASAP. So let's talk real prep, okay? Knowing all of this is one thing, all right? Doing it is another thing. And this is where a lot of my patients get stuck. It's hard to find a pelvic floor physical therapist. And not hard because it's hard to Google one. Hard is that we're few and far between. It's a reality. There's not very many of us. Our schedules are booked because of that. Right now in the clinic, I'm running a 6-week wait list. I'm trying to hire another therapist. I'm trying to hire a physical therapy assistant. There are just not enough pelvic floor physical therapists. There just aren't, okay? The other piece is that this is not standard information. This is not standard of care. This is not something that is talked about. This is not something that, unfortunately, medical providers and your medical team advocate for. Pelvic floor physical therapy, both from a prevention standpoint, so where you are right now in your pregnancy, getting ready for the delivery, training, preventing injury, preventing long-term problems that will cost way more to the medical system and to you. Preventing injury is not seen as valuable. So a lot of times women don't get referred to pelvic floor physical therapy, and the answers and what they are told when you ask your providers this are, oh, it doesn't work. Why would you do that? Oh, don't do it until after you're done having babies. It's a waste of time. Oh, just do Kegels instead. You don't need to worry about that. All of that is false, bad advice, not proven in the literature, and actually negligent. I know. It's a big word, but it's true. So seeing a pelvic floor physical therapist prior to the delivery not only is safe, effective, but it's also proven in the literature, pretty much appropriate for everybody, and will help you have a better delivery and a better recovery. It's simple. But the fact of the matter is that doesn't happen. And you don't know what you don't know. That's why you're here now. Most of you probably didn't know about pelvic floor physical therapy as something to do proactive, or even that's something that's there from a recovery healing standpoint. You might have had a friend that had a traumatic delivery, or you might have seen pelvic floor physical therapy in the past, or you might have had somebody talk about it, or you might have seen it, my TED Talk, or you might have followed me on social or something that was like, oh my God, I had no idea. But you're here now. And so now you have an idea. So now is when we take action, and now is when we start to really change the system. The other part that's really hard for mamas is that we don't have time. We just do not have time. I understand. I have 2 boys. I am a working single mom. I get it. Your time and your energy is precious, more precious than diamonds. Okay. And women's time and women's energy is not thought of being that precious. And Eve Rodsky, who I love so much, she wrote Unicorn Space. She talks about this, like, the mental load on moms and like the time that we have. And this is where the diamond metaphor comes from. Women's time, mother's time is just as valuable as diamonds, but it's thought of as dispensable as sand. Okay, but it's not. So we need to make sure that you have what you need as efficient as possible, as quick as possible, as effective as possible. So you are not spending all of your diamond precious time Googling and figuring out what's going on. Where do I go? Is this normal? What the hell is happening to my vagina? How am I going to get this baby out? My friend's vagina, tore into her butthole last time. I don't want to do that. Why does my boob hurt? I'm leaking myself every time I laugh, cough, and sneeze. Sex is painful. I can't poop. I've got a hemorrhoid. All of the things, okay, that like it's just coming at you, information overload. It's too much. It's too much. So let's create a program. Let's create a system that is going to serve you in the best way that takes into account all of these barriers: time, accessibility, effectiveness, cost. Let's put it all into one and give it to you in a way that you can use on your own time with like no expiration. You can start when you're, 2 weeks pregnant. You can start when you're 39 weeks or 40 weeks pregnant. I had somebody get in the program when she was like 39. Yeah, I think she was 39. She's like, I'm due next week. Is it too late? And I was like, no, get in there, watch everything, listen to everything in the next week. And she had her baby. She had a great experience. She was like, I didn't have time to do any of the exercises, but just like your breathing coaching and just your stretching and your advocacy and the questions that I wrote down to bring into the delivery room, they all made such a huge difference. So it's not always about like, okay, I have to do like this amount every single day. It's like you can pick and choose in the program that works best for you and where you are in your life. And that is so valuable. Okay. Down There Done Right is the full positive pregnancy test all the way to perimenopause roadmap that's going to help you reduce your tearing, recover faster, and avoid the long-term pelvic floor issues: leaking urine, gas, or stool, pelvic pain, tailbone pain, perineal pain, low back pain, prolapse, where your organs are falling out of your vaginal canal. That can be your bladder, your rectum, your uterus, your cervix, or your urethra. Okay. Very common, affects 1 out of 3 women. Not normal. All of those pelvic floor symptoms, 1 out of 3 women. So very common, affecting millions of women. Birth injury happens every single day to millions of women. It's considered normal by our society and our medical community because it is common, not the same thing. Okay. And this is where we can kind of unlink these two. You do not want to be going into your postpartum trying to keep this little baby alive on no, when you have no sleep and your hormones are going crazy and your toddler's running around and you're, just living like you're surviving life, and you don't want to be worrying about not being able to see your friends, not being able to run after your toddler at the park, being able to go back to work because you can't sit in a meeting for an hour because if you sneeze, you're going to pee yourself. All of these problems that are preventable and directly linked to postpartum depression, postpartum anxiety, and other mental health issues can be prevented or reduced significantly. Okay, your job right now is to take care of you so you can take care of that baby and have a healthy, happy relationship with yourself and with your baby. You want to snuggle baby and like smell his cute little head. You don't want to be worrying about your bladder coming out of your vagina. Trust me, I have been there personally. Okay. And I've seen everything in my career under the sun that makes my heart hurt for women, because all of these things could have been prevented if we had just listened and if we had just given women what you're going to get right now in Down There Done Right. It's so simple. It really is simple. So let's talk about the offer. Okay. So this is the best deal that you're going to see. Down There Done Right has all of our courses bundled into one. So this is called Elevate Your Birth. So Elevate Your Birth is your positive pregnancy test all the way up until the baby flies out of your vagina or comes out of your belly via C-section. Okay. Early Days is the second course. That's from that minute that baby flies out up until 6-7 weeks postpartum. There is nothing in place for women, both like in the physical world or in the virtual world, that addresses this time period, which is a super significant time period for healing and recovery. We call this the acute recovery period. So this is where we're dealing with things that you would deal with, like if you were in the hospital or if you had an injury for any other issue that doesn't relate to childbirth, even though it's the same type of issue, but that's another podcast. So I'm talking managing wounds, swelling, protecting your acute pelvic floor, getting you in compression, teaching you how to poop, that first poop, how to manage hemorrhoids, how to manage a tear or an episiotomy in your vagina, how to carry that heavy ass car seat with the baby in, what positions you need to be in terms of feeding, whether you're breastfeeding, bottle feeding, pumping, how to lay in bed, how to get out of bed, how to carry a toddler, how to do all the things that require your daily life to function. We talk about in these early days while we're managing early recovery. Okay, this is like the acute recovery phase. The third course is Postpartum Power. This is our flagship course. It's what I started with 5 years ago that I filmed at, during COVID at 3 a.m. in my living room with my phone, like tilted this way. This is designed to be started like a little bit before 6 weeks postpartum. It gives you kind of the basics that you can start to do exercise-wise from a functional standpoint. And then at that 6-week mark, when they clear you, which is like, again, a whole nother situation, it gives you step-by-step exercises, stretches, and a roadmap and a plan to make sure that you go back to life in the most effective and most safe way for your pelvic floor. So around this time, everyone's like, oh, doctor said I was fine. I can go back to exercise, go back to the gym, I can have sex, all these things. But your body is not ready and you're not feeling ready. So this is where we start to see a lot of dysfunction start to come up. So for example, if the doctor's like, oh yeah, 6 weeks, like totally fine, everything looks great. You don't feel great. You feel like your vagina's falling out. You've got pain. You still can't sit. You're leaking pee. You're still leaking poop. You've got a big old hemorrhoid in your butthole. You don't want to go to the gym and start lifting heavy. You haven't done that for not only just 6 weeks, but months probably in the last trimester of your pregnancy. So we wouldn't just jump back in at the same level that we are doing prior to getting pregnant. We need to ramp up and progressively build to make sure that you're returning to your prior level of function without these pelvic floor issues that will linger and stay around all the way through menopause. Okay, so this is where moms get really, really frustrated because they go back running and they're like, oh my God, I can't even run to the mailbox. I'm peeing everywhere. I'm peeing when I'm sneezing. I can't go back to work. I can't exercise. I can't jump on the trampoline with my kids. Like their whole life kind of flips upside down. So postpartum power really is designed to treat and address pelvic floor issues, core. So we're talking about diastasis, abdominal exercise, getting your abs strong and functioning again, prolapse, leaking, painless sex, all the things. And you can do this at any stage postpartum. We have it kind of broken up into like a time, like more phases, not necessarily time. So if you've had a baby, and let's say you had a baby and we weren't able to do the postpartum stuff until 6 months after you had a baby, perfectly fine. It's not only 6 weeks post. It's like, okay, this is your first phase. This is what you need to accomplish before we move on to the next one. Super simple, 5 minutes a day or less. So much of what I teach, both in my practice and here, is functional work. So like while you're bouncing a baby and while you're carrying a car seat and doing all these things, I'm going to teach you how to make that into an exercise or a rep. So you don't have to get on the floor and do like boring physical therapy exercises for 45 minutes. Like we don't have time. We ain't got time. Okay. So you're going to incorporate all of this into your everyday, which is going to add into small wins. And it's super effective. It's great. It's way better than spending all this time doing exercises that may or may not be effective. All right. Then the three bonus courses that I don't sell online, but are only included in this bundle. I have a course and a program specifically on return to sex. So for C-section or vaginal delivery. I have a program only for return to running. So these are for my runners, whether you like to do 5Ks or you like to run marathons. This is going to be your base. This is going to be your foundation before you start your training for running. And then we have a partner guide. And this is like my favorite one. This is for your husband. This is for your partner. This is for your birth support team. This has everything that they need to know to support you during labor, during birth, during early recovery, and during postpartum. Everything from like text scripts to, the mother-in-law that, is insisting on seeing you or being in the delivery room, to how to make sure that your bedroom and your bathroom are set up appropriately for when you get home, or how to help you in terms of holding a leg in what position, and how to advocate for you, and what meals to have on hand, and what questions to ask the doctor, and how to make sure that you are set up for success. So you also, time is diamonds, don't have to explain or ask or do all these things. Like your partner will just know what to do, know how to support you. You win here at the end, but also the empowerment that it gives your partner is amazing, because so many partners are just like, oh my gosh, I felt like totally helpless. I didn't know how to help her. I didn't know how to ask. I didn't know what to do. This was like a first experience for all. Like we had no idea. So giving them the tools that you have also without burdening you is so effective and so helpful. And so many of my partners, my dads, I do a lot of one-on-one sessions, or I guess 2-on-1 sessions with partners and husbands that come into the clinic, are like, oh my gosh, this is amazing. I wish that, all of my dad friends did this. Like we wouldn't be so like completely blindsided and like just frozen in time. Like they'll know how to jump into action for you. And the best thing that you can do for yourself is make sure that your support people are ready, empowered, and can do what they need to do without you having to manage it. So partner guide, chef's kisses. And then bonuses is that you'll have lifetime access. So no pressure. You can come in at any time, whether it's your first baby, second baby, as long as there's a down there doc, you will have access into the programs no matter what. We have an expert vault of providers that give extra knowledge. So we're talking lactation, mental health, fitness, Pilates, hypnobirthing. We have a great network of providers that are also dedicated to your well-being, and they have come into the program and given resources and knowledge for you to support this time in your life. It's a private community. We're not on Facebook. We use a platform called Circle that's only accessible by our paying customers. So for our clients, our moms that are in the program, it's safe. Everybody supports each other. We have discussion boards. We have live Q&As. Dr. Molly and I are in there doing the live Q&As. We're answering questions. You have thousands of moms in there to support you, as long as the Down There Doc team, both from an admin side and an expert physical therapy side. The other thing too is that it's 30-day money back guarantee. You don't like it? Totally fine. I'm not worried about it. I don't want you to be locked into something that is not, you don't feel is helpful for you. Okay. Motherhood is stressful enough. Things are expensive. Groceries are expensive. Diapers are expensive. I get it. Okay. I just want you to get what you need. And if this isn't it for you, I do not take anything personally. I will do everything in my power to point you to my colleagues, to programs that are better suited for you. So no risk. Okay. So 30-day money back guarantee. No questions asked. So you really are getting a bargain here. Okay, especially with one-on-one time with Dr. Molly or myself to answer your questions. It's like such a deal. I just want you to take a look at these testimonials, if you will, from moms. These are real results from real moms that have done the virtual courses. I think it's so valuable to hear it from people that have been where you are and have done it and have had these amazing experiences. Okay. I know it works. I know it does. I've been doing this for 15 years. Like, I know what is effective and what isn't effective and what's proven in the literature and what isn't. Okay. I know it already, but you need to know that it's going to work. You need to know that it's going to work for you. And you need to know that real moms and real people are doing it, can do it effectively with their busy lives, and are seeing results from it. Okay, so I want you to just take a minute and kind of read the background here of these testimonials. We get these every single day. They come in on DM, they come in on text messages, we get emails, I get people calling me from the clinic. And just imagine if this was the experience for everyone. All right, so where do we go from here? Next step. You're going to click the button in the video. You're going to enroll into Down There Done Right. You'll immediately get an email once you are enrolled in the program with your access information. You can get started now. You can get started later. Whatever works for you. We are here. This is all covered by our 30-day money back guarantee. If you decide you get in there, it's not a fit for you, no questions. You just email us, email my team, and we will get it taken care of. So remember, do this for you, mom. Do it for you. Do it for your recovery. Do it for the mom and the person and the woman that you want to be down the road. Okay. We have to start with prevention, and we have to start now. Everybody needs to do this. Everybody. And the fact that it's not standard of care is not a reason not to do it. And it will be standard of care by the time I'm done on this planet. Mark my words. Okay. So remember, you're prepping everything else: crib, bottles, car seat, siblings, baby bag. Now let's prep you. Let's get you and your body the support and the strength that it needs for bringing another life into this world. You deserve it. And not only do you deserve it, it's necessary for you to feel confident, informed, powerful, knowledgeable, empowered, ready to make the decisions that are going to benefit you for this delivery, this pregnancy, next delivery, next postpartum, your entire life as a mom. Okay, so I can't wait to see you in the program. Join us now. It's going to be amazing. Thank you so much for coming to this masterclass. You should get your PDF here that has a summary of what we're doing. Make sure that you download that. And if you have any other questions, you just let us know.